Hello.
Very good. Okay. Good morning and assalamu alaikum, everybody. I am Dr. Asif Almas-Haq, currently working in Badem General Hospital as a Registrar of Surgery. Today we are here to discuss mostly about the road to MRCS and FRCS. Now, from this very morning, I have been getting a lot of mails, lot of questions from many of you guys, and from the questions I could understand that at this point I think you guys know more about MRCS, FRCS than myself. The rules and regulations of MRCS and FRCS are changing each and every day. Every few years they are changing, so I am very sure that you are very equipped with all the necessary information at this present moment. Okay, at first, let me just give you a brief introduction about myself, about what I have done, about my academic career mostly. I have studied in my school is Scholastica, and after that at 2000 I have finished my O levels in 2001, I think 2001 I have finished my O levels, and then my college is Maple Leaf International. In 2003 I have finished my A levels, and on 2004 I have started my medical studies in Sir Solimullah Medical College. After that, in 2009 I finished my first my last prof, the final prof, then 1 year of internship. So now come the most interesting part for you guys, the training, what I have done in my training and how I have got these degrees. During I started in 2011 my training in Sir Solimullah Medical College in the Department of General Surgery. On July 2011, I have passed my FCPS Part 1, and then on, I think, in April 2012, I have passed my MRCS Part 1. So after 3 years of training, I have finished my FCPS training in 2013. And 2000 on the I think on April 2014, I have passed my MRCS Part 2. That is, MRCS is finished. This was actually MRCS, yeah, I think 2014, right? On 2015, January, I gave my FCPS final part for the first time. Unfortunately, I could not pass the first time. And July 2015, I gave the FCPS second time. Fortunately, I passed that time. After passing that, then I was trying to go to England for training or for FRCS. But at this moment, I was thinking more about the FRCS training would be very similar to FCPS. So why go for again another 5 or 6 years of training, which I have just done? I mean, I am a fellow in my own country. I will not be very comfortable going to another country and other people teaching me. I think I have done, I probably would know more about many of the surgeries than those guys over there. And I'm telling you, the training that we do in the government setting, I think if you are sincere, you can learn a lot, at least about surgeries. So I talked to a few of the guys over there in England that what is the way to get the FRCS degree, if there is any, because I have already done all those things. So they called me and they told me that you can give the FRCS without training if you can show them that you are qualified enough to get the FRCS degree. So I checked out with the Joint Surgical College Fellowship Examination website, which let me see if I can show you guys. Okay. This is the website. If you, I can see, I hopefully you can see. This is the Joint Surgical College Fellowship Examination website. And here we have all the procedures about how to give the FRCS examination if you are an international surgeon, not that's not working in England at that present moment. So I gave the FRCS exam through this website. You can all go and check out what are the necessary documents that you need from this website. Excuse me. Okay. So after that, I sat for this exam, I think in 2016 July for the FRCS part 1. Again, I failed in that part 1. I said, and then they gave it for the second time, I think in the January 2018. I passed the part 1 2018. Again, I sat for the part 2 in sometime in 2018. I again failed in the part 2. Ultimately, I got my FRCS, and the second time in 2018 July, I think 2018 July, yeah. And on the exam of 2018 July, I got my FRCS degree finally. Okay, now many of you guys. So that's sort of my degrees. Now I have now if you guys have any questions, please feel free to ask the questions. You can enter the chat box or wherever you have any questions, you can ask me these questions. Now from today morning, I have prepared sort of a lecture for you guys. But as I have already told you, I have seen that probably you guys know a lot about all these things. So, but anyway, I will just talk in short about the MRCS exam and everything. Now, hopefully you can see. This is the MRCS, the syllabus. It's in the online. So I think everybody should have this. There is a lot of information over here. What are the sections about? Background and what are the different modules. You all know about the 10 modules. You get this thing. Most importantly, if you look at this, if you can see, if you cannot see, or if you're having any trouble, please tell me. Okay. Another problem, these are the books that you need. As you can see, most of the books we have been studying ourselves, the Grant's Anatomy, the Last Anatomy, and Bailey and Love, and all those books. I'm sure most of you are familiar with this. The syllabus is over here. So check out the syllabus. Before you start, you check out the syllabus. It's very, very important that you have a good knowledge about the syllabus. Then there are some books for anatomy. These are the books you want. But the most important book, as I'm sure all of you know, that I think the past test, the essential revision notes, I think all of you should have this book. This is very, very important to pass MRCS. Now, I am not a person who would go through many books. I think it's important that you have 1 or 2 books. You go through that, make sure you know all about those books, and then maybe a few more books if there's somebody suggests some special chapters from other books. But I think for MRCS, the essential revision notes are, I think it's a good book, and I think everything is over here. I don't think anything else is necessary. Now you all know that after January 2017, when we were giving the exam, then the format has changed a bit after January 2017. Previously, when we were giving the exams, it was a 2 hours exam each paper, and 135 and 135 questions each. Now you have a 5 hours exam. Now you have a 5 hours exam with I think 500 questions. No, I think it's 300 questions. 300 questions. So that's the number of questions have increased, but the good thing is the amount of time per question has also increased. I mean, I remember when I gave the exam, I thought that the time is so little. I mean, the questions are not that difficult. If any of you have given the Part A exam, I mean, the questions I did not think they're extremely difficult, but the problem is you didn't have enough time to read the whole question and give the answer. So I had to rush. I mean, last 20 or 30 questions, I had to really rush without reading all the questions. So I think as the time has increased now, I think it's a big advantage for everybody. I think it would be a good thing for everybody. Okay. So about the modules, you know everything. Just give me a question. Okay. So basically, you all know about those things. I don't want to give you all this advices. You know, start early, go hard. Uh, I will tell you about my own story. What I did when I was giving the exam. I'm sure most of you are also doing the same thing. That I was undergoing my training, as I have just told you, and so you know that the training you have to go there at least 5 days a week, plus 2 nights each week, to maybe 1 or 2 24-hour duties. So after that, studying for a particular exam is not always easy. I know that. So I think if you want to go for MRCS, I think 3 to 4 months of time. I think if you're very disciplined and very regular person, then I think 3 to 4 months time I think is good, which was in my case 3 to 4 months which I used. So I think for part one or part A, for the first part, I think 3 to 4 months of study is good. I think that would be enough for you. Um, Read the particular books. I think that you can get all the books in New Market and Ajis Supermarket. You can get the books. Get all. I think you can get all the books. I think it's a good idea. Then from that you can read. One particular thing that I would suggest, that solve the questions. Solve the questions, and if you want, if don't study alone. That's another of my advice. Have 2 to 3 persons in a group, not more than three. I think 3 persons is good enough. If you are a if you I think if you are a guy, if you are a male person, I think have 3 male guys. It's better to have 3 male guys than another female person in your group, because I think males are easily distracted. So I think for your own concentration, if you are male, keep 3 males. If you are female, then it's okay. I think girls are always, they can keep their concentration in any situation, but if you're a guy, I think it's a better if you concentrate, if you have, it's if it's an all guys group, that would be better for you guys. um, Practice timeline, I think, as I've already discussed, 3 months to 4 months I think is good enough for you guys. mm, for part one, I think but part A, I think I don't think any more advice is necessary. This is good enough for you guys. For part B, I think a little bit more time is necessary. But what is more important is, if you are if you are going through the training, it's a very good time to give the part B, because you can also do the clinical examinations on your patients, which I did, which really helped me. I was training in Sasoli Mullah Medical College and Dhaka Medical College, in Mitford Hospital for 2 years, and 1 year in Dhaka Medical College. So I think those trainings really helped me to pass my MRCS Part B examination. Um, so I think training would be very helpful for you guys. Acha, there are some frequently asked questions. How much time should I spend daily and all those things? I think it's up to you. It's how much you can study, how much you can take in. It depends on what you are doing, because some of you guys, I know that you guys are giving other exams as well. So you have to concentrate on the other exams as well. So concentrate on those exams. Um, Now my thing is, this is an introductory class, so let's do a little bit of other things as well. I would like to tell you about what you want to do. Just 1 second, please. Okay. So number one, first and most important thing that I think I would like to tell everybody is what you need to do. There should be, nowadays, many of my students, even postgraduate students, undergraduate students, definitely, we all say, when somebody asks us a question, what would you like to do? What is your plan? Now, most of us are saying, I don't know what I want to do. Even somebody who's training in surgery, I know somebody is saying a few days back, telling me, I don't know whether I want to go into surgery or not. I'm a little confused. So these are the things. So you have to be, first and most important thing that I want to tell everybody is that you need to have a vision. That is the most important thing. Vision is most important. A planning is most important in your life, because I've just been discussing to our organizers a few months back that that our life between the time of 25 to 35 is the golden period of our lives. This is the time which we have to concentrate, which should be planned very carefully. It's after that it's really a static period, and all goes downhill for everyone. So the most important thing is that you have to have a plan. Now, the number one plan is whether you want to stay in Bangladesh or whether you want to go abroad. That is the number one thing that you have to decide on. Whether you want to stay in Bangladesh or you want to go outside. Now, if you want to go outside, then planning should be very early. One way to go over there is pass your MBBS from Bangladesh, pass the MRCS, give the IELTS, get the GMC registration, and go abroad. Okay. Now, if you want to stay in Bangladesh, then your one and only aim should be passing the FCPS or MS or any equivalent exams. That should be your number one aim. This is the thing which we have to, most important for us, that we have to decide very first, that whether we want to stay in Bangladesh or we want to go abroad. Now, if you want to go abroad and then you are studying for FCPS for 3 years, then if you are lucky, then you pass the FCPS in 1 year, that is 4 years. And then you start for your FRCS, which again goes for another 6 or 7 years of training and everything. I mean, this is absolutely useless. It's a useless waste of time, really. So the most important thing that you need to do is, if you want to go abroad, give the MRCS, get the IELTS, get the GMC registration, go abroad and train over there. Now, you may ask that then why have you done so many degrees yourself? Okay, that's a fair question. Now, two things in life are very important. Number one is money, and number two is the most important is time. Now you have to, I'm sure you'll agree with me on these two things, that the money and time, these are the two most important things in your life. So the international examinations, the MRCS, the FRCS, whatever you are talking about, this takes a lot of time and this takes a lot of money as well. So it's very important that you plan. So my plan was to give the FCPS. Because at the very beginning, I have decided that I will be staying in Bangladesh, because I did plan. I was thinking in going abroad and all those things. You know that plans don't always work out. So after a while, I decided and I thought about it hard, that what should I do? Should I stay in Bangladesh? Should I go abroad? So after some months of hard thinking, then I decided that I'll be staying in Bangladesh. So my aim at that time was to give the FCPS exam. Now, what I saw is that I have a lot of time. I have a lot of time after my training periods, and which I could utilize to get a degree, because I'm not really wasting any time. Because for MRCS, they don't ask for anything else. You can just give your certificates of the 2 years of training, and that's good enough. So I submitted those certificates and I was qualified for the MRCS exam. So I gave the MRCS exam because I was not wasting any time. So I gave the MRCS exam. And number one. Number two is it also gives you some confidence, really. Before you give the FCPS exam, if you have another exam, it gives you some confidence. And also one good thing that happened when I gave my MRCS exam is I was very proficient with my clinical examinations. So that was very helpful during my FCPS exam, which really helped me. So after I passed my FCPS exam, at that moment, I really didn't have, I was not interested in FRCS exam. Now, let me tell you something about at this point. Many of you would be probably thinking about getting many degrees in your life. Now, let me tell you something. Many degrees don't make a better surgeon. If you want to be a good surgeon, you'll have to be, you have to do things practically. 1 second, please. Okay. So if you, that is the most important thing. The most important thing is that you have, excuse me, I think somebody's calling. Okay, thanks. The most important thing is that uh, what you need to do as a surgeon is you have to increase your skills. Now, as you all know that no degree really deals with the skills of a surgeon, the hand skills that I'm talking about, the surgical skills. Most of the degrees deals with your decision-making abilities. That's how you make it, how you decide whether I should go into surgery, whether what sort of surgery I should do. Excuse me, I think somebody's calling. Okay. A lot of questions are coming. I'm sorry, but a lot of questions. I don't know I'll be able to answer all the questions. Um, okay. Somebody's asking me about the MRCS. We were supposed to give the MRCS exams, both the MRCS Part 1 and Part 2 exams from Bangladesh, but some problem happened after some year because I gave both the exams, Part A and Part B in Bangladesh. Somebody asking me about a question about how to give the MRCS. I think for the present moment, due to the Corona crisis, you have to check out with the with the website and the MRCS authorities that when the exams will be held. I don't know if it's safe or would they able to take the exam right now. So you have to check it out with those guys. I am not the right person to talk about it. Okay, yeah. Yes, a lot of guys are asking about the road to FRCS more, and I think people are more interested nowadays in FRCS than MRCS. Okay, yes, I am talking about those things. What I did. So I after passing my FCPS, after I finished my FCPS, I really was not thinking about going into doing a FRCS or something like that. I was mostly interested. I talked with many stars, and many of them gave me the advice that don't go for another degree, go for training, go for training. That, and I also thought that that's a fair thing to say, that because I know most about all the decision making, about the knowledge of surgical skills, and I've learned it from my FCPS exam. I don't think any further degree, FRCS or MS, is going to help me to be better in that. So what I did, my plan was to do some training, and I was doing some training as well. Now, even when I'm doing the training, let me tell you something about trainings. If you want, after passing your FCPS exam or after passing any postgraduate exam, um, don't go for a lengthy training, like 2 years, 3 years of training. I don't think those are very helpful, because what you need to do is you need to learn something and apply it practically. That is very important. You need to apply those things practically. And also, if you stay outside the country for 2, 3, or 4 years, then after coming back to the country, it's quite difficult for you again to readapt to the situation in the country. So what I used to do after passing my FCPS exam, I used to attend all the different conferences. I don't know whether you know that I am mostly interested in colorectal surgery. So I was the member of American Society of Colon and Rectal Surgeons, European Society, then Asia Pacific Society. So I became the member of all these associations. I get their journals. I stay up to date. I get a lot of videos from them, surgical videos. I attend all their usually try to attend all their conferences. This year I could not attend any of their conferences for obvious reasons, you know. So, and each and every conference is so helpful. You get the latest information, and you get the information, and in Bangladesh you can come back and you can help your patients with those new latest treatment, new informations. So that was very, very helpful for me. So I personally, it is my personal opinion that don't go for, after, if you have passed your postgraduate exam, go for short periods of training. I wouldn't say even go for 6 months of training. I would say go more 1 month to 2 months of training. You learn something, you attend a lot of conferences, you stay in touch with the big bosses, the top surgeons in the world. They are extremely helpful, believe me or not. You just, they have so many emails, so many questions, and they always take time to answer your questions. If you have a problem with some patient, you tell them, you send them some pictures, you say, I have this problem, and they are going to give you the best information that's possible. So that's the way to improve yourself. So that's what I was doing. Then also at a certain point of time, somebody told me that, and I was also feeling, in when you go abroad, you talk to people. Most of the people don't know about your about FCPS. You know about FCPS, that what kind of degrees you had, and what some of the people ask. Most of them don't ask, but some they ask, and I could understand that many of them don't know about FCPS. But this is a very good degree, I tell you. I am not because I'm a fellow. I think you guys will agree that FCPS, I mean, the exams are quite good. I mean, they're very, it's quite difficult to pass, and the SARS really check you out, that whether you are capable enough to become a consultant or not. So FCPS exam is a very good exam, but unfortunately, many of the people abroad, they don't know about FCPS. They know about MRCS, but they don't know about FCPS. So after a certain while, I felt that there is a necessity for a foreign degree, I think. So I was checking out with other people, FCP, FRC, to how to get the FRCS degree after my FCPS. But I never was interested in spending another 6 or 7 years of my life just training. You know, in the training, what you do, training, you listen to other guys, they tell you to hold a retractor, and here you hold it for 3 or 4 hours, and at the end of the day, you write the OT notes. That's what you do. Really, that's what you do in the training period mostly. And if you're lucky, sometimes you get to do some surgeries. So I was not interested in that. I was not interested in that. So I talked to a lot of people that what I can do, because I believe that I know I have got the necessary credentials to give the exam. So they told me that then I think you should give the FRCS exam to the FRCS exam to the Joint Surgical College Fellowship Examination System, where you can do the training abroad. And if you can show that if you have enough training and if enough experience, and if they agree, then you can give the exam. So that's what I did. And the exam is actually just the same as FRCS exam, with slight minor changes. For example, the FRCS in England, if you give the FRCS exam, you have to know about the English rules and regulations, and they ask you a few questions about the rules and regulations of the English health system. And if you give the joint international FRCS, they will not ask you those questions, because you don't need to know those questions. And there is also an academic part, which is academic means the dissertations. Academic questions, there's no academic questions in the international FRCS, but it is the same degree. You get the same recognition and everything you get in the website. There's everything is the same. So I thought this is the best thing. So I opted to go for the examination, and after a few pass and fail, then I passed in 2018. I finally passed the exam. A lot of questions are coming. Let me just check. Acha, right. Somebody is asking as to how to give the FSS exam for Bangladesh, right? if you want to give the FRCS exam from Bangladesh, after passing the exam, I have talked to many of my friends and encouraged them. Now, a lot of my friends, at least 5 or 6 of my friends, are giving the exams from Bangladesh. The first part, that is the MCQ and SAQ, the MCQ part, that exam can be given from Bangladesh. You again have to check it with your website, the current system, what's going on over there because of the coronavirus situation. But I'm sure they are going to start it. They are giving their, I think 1 or 2 batches have already given the exam from Bangladesh. So you can definitely give the MRCS exam. And yes, another question, lot of coming, lots of the guys are asking me, do I need to give the MRCS exam before giving the FRCS? You do not need the MRCS exam for your FRCS, giving the FRCS exam, but I think the MRCS degree will help you to get a, I mean, it will make the FRCS study a lot easier because you know the basic things, which helped me a lot. But definitely, if you want to go directly into the FRCS exam, you can go give the exam directly. There's not, it's absolutely not necessary to give the MRCS exam. But if you ask me, I would say that I think it would be better if you go for, I mean, pass the MRCS and then go for the FRCS. It all depends. Now, remember, what I'm saying is that if you have passed the FCPS exam, then I think it's better to just go for the FRCS. If you have not passed the FCPS, then give the MRCS first, then go for the FRCS. Because if you give up these exams before the FRCS, you know the FRCS is an expensive exam, and you don't want to sit it for 4, 5, 6 times. I mean, it's going to spend a lot of money. So I think that it's very important to be prepared. And I think FCPS, what we learn in FCPS, I think that's going to help you. If you have no FCPS degree, I think MRCS will definitely going to help you for the FRCS. Um, okay. So now how to give the FRCS exam. MRCS, I think that most of you guys know about MRCS, but if you guys have any questions, please feel free to ask me those questions. Just before I finish, let me tell you one thing. If you are, it's very important for passing the FMRCS Part B, that you join a few of the websites. I think the fastest of websites, eMRCS as a website, or e-examination. You all know about those websites. I think if you go through those websites, I think they are going to help you a lot, because the for Part B, the English people, they have a slight different way of approaching the patient, slightly different. It's not all that different, but slightly different way of introduction. And they take a lot of time introducing, asking questions. So most of us from the Bangladesh, what happens when we're during the examination, when we do the clinical examination in front of the examiner, we are very rigid. We don't talk to the patients. But if you look at those websites, if you look at those videos, even in YouTube, there are a lot of videos. So look at those videos. Take it. Look at those videos, and I think they are going to help you a lot. So do those things. For example, in MRCS exam, I would say that examination of a hernia in Bangladesh, we do not usually wear the gloves. But in MRCS exam, they would prefer that if you wear the gloves. I mean, if you don't wear the gloves, then I don't think that's a good impression by the examiner. So I think it's a better idea if you wear a gloves. So these are the small things that I think you can learn from those websites. Another problem that I think as Bangladeshis we face is the communication skills, because we are not used to communicating with the patient the way the British people prefer. So it also takes a lot of preparation, a lot of practice. So I think a few videos from the website and from YouTube, I think those are going to really help you with the studies. Oh, yeah. Okay, somebody is asking me about the training options now, about MRCS, right? About MRCS, if they do not really look for a lot of training, but I think when you are giving the Part B exam, before giving the Part B exam, they would expect you to have 2 years of training. 2 years of, before giving the Part B exam, 2 years of training they would expect from you. So you can get the training certificates from your supervisor, and just you can photocopy it and send it to them. I don't know what is the system right now, but we used to do attestation or Rotary attestation by Rotary Public, and then you can send it to the authorities, and I think that would be helpful. But yeah, I think they need 2 years of training for MRCS. For FRCS, they would expect at least 3 years of training. Even more is better for them, but they would at least need 3 years of training for FRCS. Okay, so MRCS, after MRCS, uh, what to do about the FRCS degree, how to get the FRCS. It is procedure is very simple. After finishing the MRCS, what you have to do is you have to get three referees. That's three references from um, three professors, and after that, when you get the three referees are has to be one of them. At least one of them has to have an FRCS degree. One of them has to have an FRCS degree. Number one. Number two, one of them has to be your current training supervisor, or at least head of the department of your training program. And number three is any surgeon who you were working with for last 3 years. These are the three referees that would be necessary. Uh, One logbook, I think it's very simple. Just make out, give them what are the operations that you have done recently under supervision, or you have done independently, or as an or observation. So you can just send it to them. That's it. And the training certificates that would be necessary. After you send them all these documents, they will ask you a few questions after that. And if you can satisfy them with all those questions, then there you will be eligible. I don't think it's a difficult process. A very simple process. There's no difficulty in that. So you guys can continue with that. Uh, now, many of the guys are asking me that which one is better about going through the yeah. Many of you are asking that whether it's good to give the international FRCS or the FRCS that you are or the FRCS from the England. Let me just show you this thing. I'll just give you an example. Now, hopefully you can see everything. Now, if you can see if you cannot see, please tell me if you can't see. Okay. Now, hopefully you can see the screen. Now, if you look at this, you give the MRCS exam, then there are fellowships. Now, the fellowship you can give two ways: the International Specialty Fellowship Examination or International Fellowship Examination. Okay. Now, I've given the International Fellowship Examination. Now, the thing is that if you want to give the International Intercollegiate Fellowship Examination, now then what you have to do. Let me just show you this thing. Right. Let me just show you how you have to do it. This website, actually, this is the Royal College of Surgeons of England website. I think this website has the best thing that there should best way if you want to understand the English training process. Now, the number thing is that after finishing your MRCS exam, if you want to go to England and then you want to give the exam, so what you have to do now, the thing is that you have finished your medical school for 5 or 6 years, then you have done your internship for another 1 year. Then you have done your internship for one year, and then you go to England. what they do in England, they do a foundation training, which is actually equivalent to this is the foundation training for 2 years of foundation training. This is the actually equivalent to the internship program that we are doing at this moment. Okay, after you finish your MRCS exam, then you give the MRCS exam, then you enter the core surgical training. Okay. You can start the core surgical training before your MRCS. This is again 2 years, but you'll have to do this. You can do this 2 years of core surgical training. At the end of the core surgical training, so they will expect that you give the MRCS exam. So at the here, as you can see, it is written over here at core surgical training second year, you have to give the MRCS exam. Now, after you finish the MRCS exam, then you can enter the specialty training, which say the ST, the specialty training, the core surgical training, you can say the specialty training. Now look at this, it is actually 6 years. It requires 6 years of training. So what we are, so their training is sort of like 6 years plus 2 years of core training. So that is actually 8 years. If you have the MRCS, then you can enter the specialty training of 6 years. And at the end of the 6 years, then you have to give the FRCS exam either through the Joint Surgical Committee or through the Joint College of Fellowship examination. These are the things. And then you can do, and after you do that, then you can either attain the CCT or Certificate of Completion of Training or CESR. These are the 2 degrees. I know there's a lot of difficulty, so I'm not going to describe everything. You just go to this website. Please go to this website and have a look at this. This is a Royal Surgical College website. So just go to this website and all these things are written over there in greater details. Their system is quite difficult, difficult to understand. So I think that it's better for you guys to go into the website, check it out. Now the mic thing, what I want to say here, all the reason that I'm telling you all these things is because now, if you have passed your FCPS exam, that means you passed. For example, in my MBBS, I finished my internship in 2010. In 2015, I passed my FCPS. So that is 5 years. I took 5 years to pass my fellowship exam. Now, if you after that, if you want to do if you want to go to England and do the whole process again and do the FRCS exam, get the FRCS degree, that means you'll take another 6 to 8 years to get the FRCS degree, as I just showed you. 6 to 8 years of degree, 8 years of training. So that means to get the FRCS degree, you need in my case, it would take around 13 years. So if I do the FRCS degree right now, so I would not be getting it. I will probably be getting the degree in I think 2023. Probably if I pass in one go, then 2023 I would probably gonna get the degree. Now, on the other hand, if you go through the other channel, that is Joint College of Surgical Fellowship, and which gives the international degree, which is an equivalent degree in every way, you do that and you can get it. And I have got my FRCS degree in 2018. That is 3 years after passing my FCPS degree. Now, Michael, now I know that many of you will be asking that now what you want to do. Now, if you want to go to abroad, you can always go abroad. And now you don't go for the CCT, you go for the CESR. Now you go for the CESR, you can also check it out in the website. Let me see if I have it. I think I have everything over here. Let me just show you. Here, if you look at it, hopefully you can see the system. Now, this is the CCT program. The CCT program is you have completed a GMC approved training program. If you have completed a GMC approved clinical training program, then that means how long you're going to take. 2 years of foundation training, 2 years of Crohn training, that is 4 years. Then 6 years of specialist training, that is 10 years. And then how long, whatever time you need to pass. So that at least 10 years you need to get your CCT. And then after that, you have to sit for then you can specialist, you can be the specialist register for the becoming the consultant. On the other hand, if you have the foreign degree and the FRCS, then you don't have, that is, do not complete a GMC approved training program. You have to go through the CESR. CESR means Certificate of Eligibility for Specialist Registration. This is the pathway that you have to take. You can go to the website and you can check this all out. So you don't have to think about it. The website, everything is given. I think that this system is much better, because if you want to save time, because you don't want to save, you don't want to spend 13 or 14 years of your life just getting 2 degrees if you have the FCPS. But if you don't have the FCPS, then I would suggest then you go abroad. That what I have told you previously, then you go abroad and finish your FRCS degree. That's not a problem. But if you have the FCPS degree, then I would highly recommend that you go for the international FRCS, which is an equivalent degree in everywhere, and the pathways are all the same. Everything is same, but you get the degree much faster. And what is more, the great thing about the FRCS degree is, once you go abroad, once you talk to a lot of people, for example, you go to India. Now in India, you will see that a lot of the big doctors, they have the FRCS. Now, if you have an FRCS, if you talk to those guys over there having the FRCS, you'll see that their reaction to you a lot different. They appreciate you more. They talk to you with a lot of importance. They even ask you when you have passed your FRCS. I have passed in this. I mean, they feel like as if you are at par with those guys. So, and they know their qualifications. So that's the thing. If you have an international degree, that is the way it's going to help you. But I always remember that I always suggest that if you want to stay in Bangladesh, always go for the FCPS or MS or an equivalent degree. There's no question about that. When you have that degree, then you get another degree, get another degree. And if you want to get another degree after FCPS, I would suggest go for a foreign degree. Don't go for FCPS general surgery and then MS general surgery. I mean, there's really no point to do that. And you're getting the same degree. It's like after passing the HSC exam, you're getting another HSC examination. If you're giving another HSC exam and getting another certificate, nobody's doing that, right? Nobody's even doing HSC and then O levels again. So because they are the same thing. So don't go for the same thing. If you want to go for another degree, get 1 degree from Bangladesh, 1 degree from abroad. I mean, that I think would complete everything. That is my suggestion. Of course, I mean, every person have got different suggestions, different ways of thinking. I respect all of your thinking. If you think that, no, I want to get 5 degrees, I don't have any problem with that. It's not a problem for me. But what I am saying is that if you want optimum use of your money and optimum use of your time, I would suggest that this is the thing you guys want to do. This is my suggestions. Definitely. Okay. There are a lot of questions. Let me have a look.
Can I ask one question? Hello.
Hello. Hello.
Hello. Can you hear me?
Yes, please.
Oh, I have a question. Thanks for your class. Actually, I observed that few questions. That means the FRCS, about the international FRCS. You explain that difference between international FRCS and FRCS done in the UK.
Right, which I have already discussed.
Same, equivalent.
Yes, they are, number one, they are the equivalent examinations. They are equivalent in everywhere. But if you want to go through firstly, let me just explain what are the minute difference between the two examinations. The international FRCS, in the international FRCS, as because you are not a doctor in UK, so there will not be any questions related to the UK law rules and regulations, because you probably will not be working over there, so they will not ask you any questions regarding. I'm sure when you are studying the MRCS, you'll see there's a lot of questions regarding the UK rules and regulations and what you are going to do in this situation and that situation. These questions will not be there, number one. And number two, the academic part, there is another 5 or 6 questions that comes from the academic section. The academic sections meaning the dissertation or any publications that you have done or you are doing. as because you are not working over there, so they will not ask about any publication. Which in Bangladesh in FCPS, which you do is the effort, the dissertation that you do. That is the thing that you don't have to do, because there's no point. I mean, you cannot pass the dissertation over to England and then get them checked because of the ethical issues and everything. But in every other way, the two exams are the, there is the part one, there is a part A, there is two parts, same number of questions, and the format and everything is the same, except those two parts, the academic part and the questions about rules and regulations in UK. And another difference is when you are going to, if you are after passing the international FRCS, if you want to go abroad, go to England to work, then to the enter the specialist registry, you have to go to the CESR pathway, which I have just showed you. You have to go to the CESR pathway, not the CCT pathway, because CCT pathway represents those who has worked in under the GMC. So as you have not worked under the GMC, you will go to the CESR pathway, which is all, everything is in the website. You can just have a look into the website and you will get all the necessary information.
For application for a direct FRCS, international FRCS, which paper needed to submit the Royal College of Physicians and Surgeons?
Acha. For FRCS examination, international FRCS, you have to go to the website and everything is written over there. You know, just go to the Joint Surgical College Fellowship Examination website. Joint Surgical College Fellowship, excuse me. Hello. Hello, sir. হ্যাঁ, আমি এখন একটু একটা মিটিং এ আছি, আপনার সাথে আধা ঘন্টা পরে কথা বলি, ঠিক আছে? আধা ঘন্টা পরে। ওকে। Okay. Let me, if you want, just give me a moment. I'll show you the website. It's over here. So just excuse me. Yeah. Can you see?
Yeah.
Yes. This is the website, Joint Surgical College Fellowship Examination, and you can look over here. They have written everything, all that information that you need. What is the syllabus? Everything is actually the same. The syllabus and everything is the same. It's written over here. Every question, all the questions you have. What is the syllabus? What is the rules and regulations? Where the exams going to be held? What are the minimum qualifications that would be necessary? What would be necessary for you to sit for this exam? Everything is written over here. So go to this website. Everybody who is interested in this, Joint Surgical Colleges Fellowship Examination website. This is the website for you guys. I highly recommend that you give, if you want to, if you, after passing the FCPS, if you want to go the FRCS, don't go through the GMC system, because that would be extremely lengthy and you'll take round about 10 years, almost I think 8 to 10 years to ultimately get your FRCS degree. Probably something like that. But if you go through this, for example, I got the FRCS degree in 4 years, I think, after passing my FCPS. So I think that this is because it in an every way it is the same. You get the same certificate, you get the same recognition. That's the thing. So you do, if you want to, even you want to go to abroad with this, you can go through this. But if you don't have the FCPS, then I would suggest that you go abroad and get through the training and then go the FRCS. If it is your intention to work internationally, then I think then the other way is the good way, because you will be staying over there. So go through their system, it would be better for you. But if your plan is after passing the FCPS you want to stay in Bangladesh, also get an international degree, this is definitely the choice for you. If you guys have any further questions, definitely you can ask me. I don't think after going through this. Ji.
I have one question. আমি একটু বলি, সেটা হচ্ছে আমাদের একজন সিনিয়র, আমি যতটুকু জানি যে তারা এফসিপিএস পাশ করার প্রায় 10 বছর পরে এফআরসিএস এর জন্য অ্যাপ্লাই করেছিল রয়্যাল কলেজে পরীক্ষার জন্য। তো তারা একটু পরীক্ষার জন্য রেজিস্ট্রেশন করতে দেওয়া হয় না, এটা 2018 সালের কথা। রেজিস্ট্রেশনে পারমিশন দেওয়া হয় না। এই জায়গাটা আমি একটু ক্লিয়ার হতে চাচ্ছি যে কেন আর কি এফসিপিএস প্রায় 10 বছর পরে এফআরসিএস পরীক্ষার যে ইন্টারন্যাশনাল যে এফআরসিএস পরীক্ষা মানে
Right.
রিজেক্ট হয়েছিল, তারা পরীক্ষাটা বসতে পারে নাই, রেজিস্ট্রেশন করতে পারে নাই।
আচ্ছা, okay. Thank you for the question. I think the most probably they have not followed the examination guidelines, because after I have passed my examinations, I have um, advised at least 10 guys, 10 of my friends who are still working in now Dhaka Medical College and Midford. I have advised each and every one of them, and I have guided most of them through the procedure. They have asked me a lot of questions, and all of them actually were successful in giving the examinations. I think most likely there is some problem with the procedure they have been following. Probably the correct format was not followed. I think if you follow the correct format, there should not be any problem, because all these guys who are now sitting for the exams, they have followed the examination guidelines, and all of them are giving the exams. I think that if you're having any problem, the helpline is very, very helpful. They have a contact address. There is the contact address. You contact with those guys. I mean, they're here. If you see the contact, yeah, if you
Yeah.
can contact with these guys, they are very, very helpful. I mean, almost within an hour or 2 hours, they give you the answer. So you contact with those guys, you ask them what the problem was, and you can correct it. I am sure if you have FCPS, there should be no problem in giving the FRCS. I mean, you can directly sit for the exam. I can guarantee you 100%. Because everybody is sitting like that. I have done it. My friends, my colleagues, they're all sitting with the same procedure, and they have been always successful in giving the exams.
Thank you. Another question. After passing MRCS Part B, they need to go UK and job and go through the GMC procedure. But it is easier than PLAB or MRCS or PLAB easier to got a job and completed the surgical training in UK?
Acha, MRCS naki PLAB. I would suggest that if you have finished your MBBS degree, I think it is better you go for MRCS. Because if you give the MRCS, with the MRCS, you get a certificate. I mean, PLAB is not a certificate. You cannot use the certificate for very long. And I mean, it has got an expiry date with it as well, I think. You give the MRCS exam, you get a certificate that stays with you for the rest of your life. With that, you go for the IELTS, which is not a very difficult exam. You sit for the IELTS exam, maybe you take one or two exams to get the 7.5 average score, and you get the GMC registration. I think that would be very easy. But certainly PLAB is also, I think, if you have no training, if you have no training, or if you are sitting for the exam earlier, I think PLAB is also a good idea. It is individualized, really. I mean, it's for me, I think for me it was always going for the MRCS was the best idea. But there are a lot of other guys who are very junior. I mean, maybe in the third year, fourth year now, they're going for the exam. I think for those guys, it's better to go for the PLAB.
অ্যাকচুয়ালি প্ল্যাব যেটা সেটা তো জিপি প্র্যাকটিস, কিন্তু এমআরসিএস যেটা সেটা তো আমরা হচ্ছে অ্যাকচুয়ালি সার্জারিতে যারা যাবে তাদের জন্য।
Right, right, right.
সার্জারিতে যখন যাবে, আমি বাংলাদেশের যদি ভিউ নিয়ে দেখি যে আমি সার্জারিতে ট্রেনিং করব, তখন হচ্ছে যে আমি সার্জারিতে একটা ট্রেনিং পোস্ট চাইবো, গভর্নমেন্টে হোক প্রাইভেটে হোক। তখন কিন্তু আমি মেডিসিনে চাইবো না, বা আমার জন্য ফিল্ডটা কিন্তু শুধুই সার্জারি হলো। তো এই ক্ষেত্রে কি এমআরসিএস এর জন্য যখন কেউ ট্রেনিং এ ইউকে তে সার্জারিতে চাইবে, এমআরসিএস পাস করলো, দ্যাটস ফাইন, বাট সার্জারিতে যখন সে ট্রেনিং করতে চাইবে, তখন এই এই প্রসিডিউরে কতটুকু চান্স আছে যে বাংলাদেশি ইউকে যারা আছে লোকাল তাদের সাথে কম্পিট করে?
Right. It's a very good question. It's a very practical question, actually. Naturally, I mean, if you are going from Bangladesh, because these posts are very limited, as you know. The training posts, all training posts are very limited. It's not like Bangladesh, যে আমরা এখানে অনেকজন ট্রেনিং করে. Usually one consultant has 2 to 3 trainees, because for supervision. So it's very, very competitive, and they will definitely want someone from their own country, I think. So there would be, for us it would be a disadvantage if you go over there. Definitely, I mean, you would be the second option. If there is a English guy who is applying and who has the same qualification as you, I'm sure that they are going to select the English guy first rather than you or me. So that would be a problem. But even in that case, what you have to do is you have to have connections with a lot of people. I mean, connections always help. You know, what you need to do is you need to talk to the consultants, your favorite consultants, 2 or 3 consultants that you're coming from Bangladesh, you want to work with you. Okay, so that this guy knows you. So whenever you have the MRCS and you ask for if you want to work over there after getting the GNC registration, they have a soft spot and they can select you. So communication is also very important. You have to communicate with their consultants. I mean, I know it's very difficult, but again, you have to go over there. That's why what I do is I go into a lot of conferences and then I talk to a lot of these big bosses so that they know me. So that next time if I have any favor to ask, if I ask them, say, sir, I want to work with you guys for 7 days or 5 days or 1 month, and they say that if they know me, then they say that okay, you can come and work for me.
তার
So
মানে আহ, এটা কি হয় যে আমি একজন সাপোজ ইউকেতে একজন কোলোরেক্টাল সার্জনকে চিনি, ব্রেস্ট সার্জনকে চিনি, অথবা একজন অর্থোপেডিক সার্জনকে আমি চিনি। So আমি যদি যখন আমি এমআরসিএস পার্ট বি পাস করলাম, এখন আমি চাচ্ছি ওখানে একটা মানে যেতে আর কি ট্রেনিং এর জন্য বা কমপ্লিট করার জন্য, চাকরির জন্য, তখন কি আমি ডাইরেক্ট যদি আমার যে পরিচিত যারা হয়তো বা আমাকে একটু হেল্প করবে বাংলাদেশি বলে, আমি যদি তাদের হেল্প নেই বা চাই, তাহলে কি এটা আমার জন্য কাজ করবে বা তারা আমার জন্য করতে
definitely,
পারবে কিনা?
definitely, there are a lot of Bangladeshi consultants over there. You can definitely, you would be their first choice. I'm sure they you would be their first choice. আপনারা, you can talk to those guys, those SARs, those consultants. যারা ওখানে কাজ করেন. I have seen many of them doing very well, and they are getting top positions over there. So if you go over there, talk to those them. I think that would be very helpful. In fact, some of the SARs also come to Bangladesh. You see a lot of SARs, a lot of consultants from England come to Bangladesh and attend a lot of conferences. It is very important that you attend those conferences and you talk to the SARs and get to know them, make sure get their emails, keep in contact with them, and then when you need them, then you ask for a favor.
দ্যাট মিনস যে কনসালটেন্টরা যদি আমাকে ফেভার করতে চায়, তাদের সে অ্যাবিলিটি আছে যে আমাকে ফেভার করতে
Definitely,
পারবে তারা।
definitely. Because it ultimately the consultant decides who's going to train with them.
ফাইন, থ্যাংক ইউ। অ্যান্ড অ্যানাদার কোশ্চেন, এটা যদি আমরা এরকম হয় যে ধরেন যে একজন এমআরসিএস পরীক্ষা পার্ট বি দিবে, আহ, তো দেওয়ার আগে হয়তো বা একটু অবজারভারশিপ করে আসলো, যে তার একটা এক্সপিরিয়েন্স হলো। তো এই এই অবজারভারশিপের যে সার্টিফিকেটটা, এটা যখন সে এমআরসিএস পার্ট বি পাস করে চাকরির জন্য অ্যাপ্লাই করবে, তখন কি তার জন্য কোনো রকম, ওটা কিন্তু অবজারভারশিপ মানে নট জিএমসি রেজিস্ট্রেশন নাথিং, তো যখন এমআরসিএস পার্ট বি পাস করার পর অন্য কোথাও চাকরির জন্য বা ট্রেনিং এর জন্য অ্যাপ্লাই করবে, এটা কি তার
Observership,
জন্য
if
হেল্প
you have,
করবে কিনা?
right. I mean, each and every document, I mean, if two persons, one comes with an MRCS and one person comes with an MRCS plus an observership, certainly the guy or the girl with the observership will get preference. But ultimately, ওই সময় তো each and every quality check করা হয়, কারণ these are actually so competitive যে ওখানে গিয়ে ultimately each and everything they look for, যে what are the qualifications they have. Now, two persons having the same qualifications, two persons are having same MRCS, the person with the MRCS plus observership will definitely get the job.
অ্যাকচুয়ালি আমার যারা হচ্ছে জুনিয়র ছেলে মেয়েরা এমআরসিএস পার্ট বি পরীক্ষা দিচ্ছে, আমি তাদেরকে সাধারণত একটু সাজেশন দেওয়ার চেষ্টা করি যে পার্ট বি বা দেওয়ার আগে যদি 1 মাস অবজারভারশিপ করে আসে, হয়তো তারা ওই থিঙ্কিং বা ওখানকার যে অ্যাটিচিউডটা, যেটা বাংলাদেশের থেকে একটু ডিফারেন্ট, এটা দেখে আসলো, তাহলে এটা যে শুধু তার পার্ট বি পাস করতে হেল্প করছে তা না, ইন ফিউচার তার একটা সার্টিফিকেট বা একটা চাকরির জন্য তাকে হেল্প করছে, বা ট্রেনিং এর জন্য আদারওয়াইজ যদি কোথাও যেতে চায়, একটু ডিফারেন্ট, এটা দেখে আসবো তাহলে। এটা
Definitely.
যে শুধু তার পার্ট বি পাস করতে, থ্যাংক ইউ,
Thank you.
তার একটা সার্টিফিকেট বা একটা
Ji. Hello. Yeah, thank you very much. If you have any more questions, I can ask. I think our time is up for today. Certainly, we are going to meet in the future. Thank you, guys. Thank you, everybody, for coming and taking your time on this beautiful Friday morning, not going outside and listening to my boring lecture. Thank you so much. I'm sure we are going to meet in the future. If you guys have any questions, you can ask me. You can have my emails or anything. I'm always there to help you guys in any way possible. I have my students. I'm I've got this. I mean, whatever questions you're gonna have, my students are always asking me this and that questions. So you guys can also always come over here. You can go, ask me all these questions. How to help? I have got a lot of resources. I can help you with those things. So there's no problem. Please feel free to ask any questions or any help you need. Thank you very much, and assalamu alaikum.
Before finishing, I have one question. Hello.
Ji, 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 ji.
Sorry to interrupt. Actually, from the comment box, anyone comment that maybe he completed FCPS or MS in branch. Branch, that means not in general surgery. Then he wanted to do FRCS in same branch, like orthopedics, like colorectal. Have any option this? That colorectal MS, so colorectal in FRCS?
As far as I know, colorectal. I mean, I wanted to do an FRCS in colorectal surgery, but that's not I think colorectal FRCS is not there.
All are general surgery, right?
Right, in general surgery. That's right. You have to do it in general surgery. Do an FRCS.
Thank you.
Thank you.
All are general surgery, right?
Acha, the international FRCS where it's held. Acha, lot of questions are here. I think we have to answer a few questions. Training will start in. Somebody asked me about after passing the MRCS. It's actually again that what I have said, that after passing the MRCS, you have to get the GNC registration, and then they will decide. You have to apply whichever places you want to go, and they will select you. It's actually the same. I mean, in Bangladesh, what we do, we after finishing our MBBS, we go to Dhaka Medical College, Solimullah Medical College, and the other hospitals for our training, and then they select. It's the same way over there. Informative after passing, it's the same. Yes, একজন জিজ্ঞেস, somebody asked me about if you আচ্ছা আচ্ছা, okay, okay. I think you're right. আমাদের অর্গানাইজাররা বলছে স্যার আজকে একটু we are over. There are a lot of questions. We will definitely go through the lot of questions. Keep the questions coming. You can contact me in my I think I'll have to open what is that thing, the Facebook live or something like that, to help you guys. Don't worry, we will come to this platform again, Road to MRCS and FRCS. We will discuss further. Today, unfortunately, we are out of time. A lot of questions are there. We will definitely answer all the questions. I'm definitely like to help you guys. Thank you so much, and assalamu alaikum.